The call has gone out for the urgent vaccination of health workers following a COVID outbreak at a Sydney aged care home. 3 residents have tested positive at the Summit Care Balcombe Hills facility, where 2/3 of staff are unvaccinated.
The facility has been plunged into a 14-day lockdown. Michael Maher, who founded the Aged Care Development Network and whose digital immunisation register is used in Victorian hospitals, said this issue would never have arisen had the government implemented a proper tracking system. And Michael joins us now live from Melbourne. Good morning to you, Michael. I understand you warned the Aged Care Minister, Richard Colbeck, that this could happen.
Correct. We first approached the Minister about 15 months ago when we needed to track flu shots so that you could lower the number of upper respiratory diseases or viruses in aged care so they could better isolate people with COVID. At the same time, you had to track the 4 questions. Have you been overseas? Have you been with someone with COVID, etc.? And then when COVID tests came in, it was again approached. And then recently with now there's COVID vaccinations. Unfortunately, the aged care providers don't have much support in this area, which makes it very difficult for them.
Michael, the federal government does have a register of sorts, but you say it has shortcomings.
So the Australian Immunisation Register under Human Services only tracks the vaccination. You can't share the details. So if I work in a highly regulated field like an aged care worker or a doctor or nurse in a hospital, I can't connect that to my employer's HR system and have it updated there. I've got to manually bring it in. So what we're trying to do with technology is get away from those manual steps, but it doesn't solve that problem. So it solves it for the government, but not for the providers.
So, Michael, the vaccination of aged care staff we're talking about at the moment, it's not mandatory. Should it be?
Actually, it has just become mandatory last week, end of last week. So until now, it has been a debate. And then the Premier of WA said that he was going to make it mandatory in WA. And about 48 hours later, at a National Cabinet meeting, they decided to make it mandatory in Australia. The problem is the rollout will then take some time. When, for example, between the flu shot, which was made mandatory, and the COVID vaccination, you have to have at least a 2-week break. So when all the flu shots are being done previously, for workers, the residents are being given the COVID vaccination, so they couldn't do it at the same time.
Well, rephrasing it then, should it be a priority that our aged care workers get maybe the first shots of Pfizer?
Most definitely. Anyone who works in a situation like aged care or healthcare where they're working with the most vulnerable in society, they really need to have that straight away. What's been frustrating is what the minister gave instead was, after he was questioned in the Senate Estimates Committee about how many workers have been vaccinated, and he couldn't give that answer, the department rolled out what is equivalent to a spreadsheet that providers have to update each day with how many people have been vaccinated. The problem is, firstly, there's 3 key issues over that. Firstly, they don't have an immunisation register. So on site, they're basically tracking things in a spreadsheet. So I would say that the outbreaks that have happened just yesterday in Sydney and a few weeks ago in Melbourne, they were all because they're trying to track things in a spreadsheet, so they don't know who they've missed very easily. Secondly, they can't easily run a report to actually update the government. And so if I'm just handing that, I walk into my employer and I give them a little certificate and say I've got the vaccination, and they register me, well, I might work for 2 other homes. So I'm being registered by 3 different employers as a vaccinated worker to the government, so that the data they're getting is inaccurate. And thirdly, most aged care homes are short of resources, admin staff. So if all of us are walking in with a piece of paper and handing it over, it makes it a very digital, it's very manual and long process to actually get all that information registered, which means things get missed. And so if someone's away on holidays, they get missed. Yeah. And that's how the outbreaks happen.
Michael, you make a lot of sense. Thank you very much for joining us this morning.
Very welcome.
Thank you. Stay safe.